Here we go. Hey everyone, welcome to the GRadulting Workshop Series. Today's topic is health insurance for graduate students. My name is Debbie McCutsky, and I am the coordinator of services and programs for graduate student legal aid. Before we discuss health insurance, I want to ensure that all grad students know about legal aid. So, of course, we offer workshops just like this one. It's called the GRadulting Workshop Series. And we also provide support to grad students who need help with a legal issue, an immigration issue, a university charge, notarizing a document. So if you paid your graduate student fee, which I'm sure you have, then you've paid for our services. There's no additional charge. So visit our website to learn more about our services and how to request an appointment, or just reach out with an email. We are happy to help you. So a bit of housekeeping. Automatic closed captioning has been enabled. I will share an evaluation with you all to fill out so we know how are we doing with this workshop. I'll email links to that evaluation, the slides, and the recording either this afternoon or tomorrow morning. So everyone will have access to those resources and a few extra things. And let's see, we welcome your questions. We want this to be a conversation, not just a lecture, because we know the reason you're here is you probably do have questions. So use that Q&A feature that you see at the bottom of your screen. So I think we are ready to go. I am so happy to welcome back Miss Robin Kotzker. Robin is the program manager in the Office of Funding Opportunities at the Graduate School. And one of her many duties is to help coordinate the student health insurance plan for graduate students. So Robin, yay you. Thank you for being here today.
Hi, thank you. Thanks.
And I also want to welcome Amanda Haynes. And Amanda is with AHP, which is Academic Health Plans. Did I get that right? Okay, great. And so Amanda and Robin work very closely together to support you and to help students figure out health insurance at University of Maryland. So I'm going to turn things over to Robin. Robin, please go ahead and share your screen and take it away.
Hi, everybody. Welcome. I hope everyone's able to see my screen. It simply says health insurance right on the front page. Okay, good. I'm happy to share information with you today about the University of Maryland's health insurance policy and how to navigate this whole process. I want to say at the front that I am not an insurance expert. I am more the administrative person that assists students in getting what they need. So I don't have today information specific to health insurance plans, but I have information that will help you navigate the process. So I hope this helps. Please feel free to ask questions while I'm talking. I'm happy to address them as we go. One thing I want to note on this, first of all, you will be receiving these slides. We're happy to share these. I'll probably post them on my website, on the graduate school website. I think that's probably the best way to go for that. But one thing I wanted to share with you on this very first screen is that on the right side, you'll see that there's a health insurance webpage that provides a lot of detailed information about how to navigate this process about health insurance, the policy, and how to purchase, ship, or if you're a graduate assistant, how to handle those, how to get insurance as a graduate assistant. So there's a lot of different kinds of students we have, and depending on where you are in the program, if you're part-time, if you're full-time, if you're a graduate assistant, all these different factors will weigh into how you purchase your health insurance plan. So I'm going to move on from here. Let's see if I can get to the next screen. There we go. There we go. Okay. So first of all, I'm going to start with a policy. All graduate students enrolled full-time in a master's or doctoral program at the University of Maryland College Park campus must have health insurance. That is the policy. And this year, we are requiring students to either enroll in the student health insurance plan or waive out of the student health insurance plan. So if you are a full-time student, this policy pertains to you. Part-time students, non-degree seeking students, students enrolled in the certificate program or exclusively online programs or programs at a different campus that we have called Shady Grove all students are encouraged to have health insurance, but those students in that second bullet are not required, and they will not be automatically enrolled, and they will not be charged for SHIP, the student health insurance plan. And if I said that very fast, I'm sorry. SHIP is short for Student Health Insurance Plan. And again, the website on the graduate school website is listed on this slide. So there's lots of information there for you to read through and to learn more about how you would need to navigate this process. Okay, so why does everyone need insurance? I mean, that's the overarching question. Well, I mean, it's very important that graduate students have health insurance. Maintaining insurance coverage is important for ensuring physical and mental well-being while you're in graduate school. Healthcare services, as you may have already heard, are very expensive in the United States, and getting sick without insurance can total thousands of dollars. I mean, just breaking an arm and going to the emergency room can be a large bill. So having insurance is really important when you're in the United States. You don't want to have unexpected healthcare costs because that will definitely impact your ability to finish your graduate studies, as not to mention your mental well-being. So that's why we have the policy. Is there a question? No? Okay, I'm sorry. I heard somebody start to speak. Okay. Okay, so graduate health insurance options at University of Maryland. I've mentioned already the student health insurance plan, the acronym is SHIP, and we talk about it all the time now. All graduate students are eligible to enroll in SHIP. Full-time students are required unless they submit a waiver. So, there's a lot of things to think about as you start this process. So if you are a full-time graduate assistant and you're enrolled full-time in graduate school, you will be enrolled in SHIP and you will be charged on your student account unless you submit an insurance waiver. And the more information about SHIP is found on the Academic Health Plans website, which is that link that you see on the top bullet. Academic Health Plans is the broker. Basically, they administer the SHIP plan. They are the ones they are the middleman between students getting insurance and you having insurance. So they're the ones you purchase your plan through. When you purchase a plan, when you purchase SHIP, the Student Health Insurance Plan, the insurance carrier is United Healthcare. So that's sometimes the students don't quite understand the role of AHP. I'm sorry, I used an acronym there. Academic Health Plans, we call them AHP. And Amanda here is smiling because she works for AHP and she's in the customer service team. So if you have a question, she might be one that you actually ask the question to when you talk to somebody from AHP. So she'll chime in with more information probably at some point today. So one option as a graduate student at University of Maryland is to purchase SHIP. If you already have insurance, you don't have to purchase SHIP, you can waive out of SHIP. And I'm going to get into this more in the later slides. Another option at University of Maryland is for graduate assistants. Graduate assistants are those who actually have a job in their program where they teach or they do research in a lab or something like that. And that means that they are working here at University of Maryland. And if you're working, then you have the option to purchase a plan through the state of Maryland. This is only available for graduate assistants. So if you're not a graduate assistant, you don't have this option. And then the third option for health insurance would be to have an external plan. Some people find a plan completely external to University of Maryland. Some people are on their spouse's plan. Some people are still on their parents' plan. So if you already have insurance, you will not want to have the student health insurance plan. You'll want to submit a waiver. And the waiver portal can be found at that link below. Any questions so far? Okay, so a little bit more into the weeds about SHIP versus the state of Maryland plan. I sort of touched on some of these points already, but I just wanted to sort of lay it out there so that people have a more clear sense of what the differences are with regard to how you go about signing up for them or if you're even eligible. So for SHIP, for the student health insurance plan, if you choose that, you can either opt in right now, you can just go to their website and opt into a plan, or you can wait for the automatic enrollment process. Either one will work. In both cases, your student account would be charged for the 12-month plan, the annual SHIP plan. That's completely your choice. You can wait or you can enroll now. No matter what whether you enroll now or you wait, whichever one you choose to do, your coverage for the student health insurance plan would begin August 1st. Even if you enroll today, August 15th, your coverage will have begun on August 1st. So if you had seen a doctor on August 2nd, you would be covered for that. So as I mentioned a moment ago, Academic Health Plans, AHP, is the plan administrator for the student health insurance plan. So when you go to enroll for a student health insurance plan, you're going to be using the Academic Health Plans website to do that. The SHIP insurance carrier is United Healthcare. So AHP is not your insurance. AHP just helps you purchase the insurance. United Healthcare is the insurance carrier. And more plan information of the United Healthcare insurance plan can be found on the AHP website that's listed there on the third bullet. And I mentioned a moment ago, coverage for SHIP is 12 months, starting August 1st through July 31st, 2024. Even if you were to graduate in December, that coverage will remain in effect. So that's an important piece to know. When you have the student health insurance plan, if you purchase it now for the year, you have it for the year. It's not going to end if you graduate. And I have already also mentioned that when you purchase SHIP or when you enroll in SHIP, a one-time charge of $2,334 would be billed to your student account. And if you need help with paying that off, our Student Office of Financial Aid and Cashiering offers a TERP payment plan. So if you wanted to enroll in that, that will help help you to spread out the cost of this SHIP plan. So that's for SHIP. That's full-time students who are not graduate assistants. How you would go about purchasing, enrolling in SHIP, and how your student account gets billed. Any questions on SHIP at this point? Okay. So the state of Maryland insurance plan is only, as I mentioned before, it's only for people who are graduate assistants. Only students who are hired as a graduate assistant are eligible for the state of Maryland insurance plan. So when you're hired as a graduate assistant, basically that could occur. Most people who are hired are already hired, but when you're hired, you would receive an email from the state of Maryland that will help you enroll in the state of Maryland plan. So the state of Maryland is the plan administrator for the employee plans. And if you want to look at the different options available for the state of Maryland plans, you would go to our Human Resources website. It's listed there on the third bullet. And for coverage for the state of Maryland plan, if your start date as a graduate assistant was July 30th, which many of them did start on July 30th, then the coverage would be the first day of the month following that start date. So in that particular case, the insurance from the state of Maryland would begin August 1st. But if your start date for your GA appointment was August 12th, then the first day of your insurance would be September 1st. So it's just good to know when your insurance would start. And let's see where I am here. Oh, and so with regard to paying for the state of Maryland insurance, it is it's deducted from your paycheck every time you get paid. We get paid bi-weekly, and so your insurance premium, it's called, would be deducted from your pay. Any questions on that? Okay. Okay, so now I'm going to get into the fact this automatic enrollment piece, which is new this year. So it's gotten, people are quite confused, departments are confused, students are confused, I'm confused. But at the same time,
excuse me, Robin.
Yes.
Sorry to interrupt you, but a question did come in.
Okay.
Here we go. Grad students are automatically enrolled for SHIP, but not state of Maryland insurance. That's the first part.
Yes, that is the correct statement.
Okay. So is there a plan to spread out the payment for the state of Maryland insurance?
Okay, so those are good questions. So, and that I'm going to go back a screen to sort of like direct you to the, if I can get to my next, okay. I'll go back to this screen for a moment. So grad students who are not graduate assistants, keep that in mind. Those are the ones who are automatically enrolled in SHIP. If you're graduate assistant and you want the state of Maryland plan, which most do, you actually have to wait for an email from the state of Maryland and enroll that way. So you're not going to be automatically enrolled in the state of Maryland plan if you're a graduate assistant. So the first thing to ask, whoever asked that question, the first thing to think about is, first, are you even eligible for the state of Maryland plan? And if the answer to that is yes, then you would wait for an email from the state of Maryland and you would enroll that way. And then once you're enrolled, you're to pay for that, it gets deducted from your paycheck every 2 weeks. So it's a small deduction every 2 weeks. So you wouldn't need a payment plan for a state of Maryland insurance. I hope that answers that question. Am I missing part of the question because it disappeared on me?
No, it looks like you got it.
Okay, great.
If there are further questions, just put them in the Q&A, please.
Great, thank you. And so now I'm going to talk a little bit more about that automatic enrollment process, which on this slide talks about automatic enrollment a little bit. Maybe this will help clarify a little bit of your confusion, or if you have confusion. So automatic enrollment, and I've mentioned this before, full-time registered students at College Park will be automatically enrolled in the student health insurance plan, and a charge of $2,334 for a 12-month SHIP plan will be charged to the student account unless you submit a waiver. So that's very quick version of the policy and how it works. There's an exemption. If you are a graduate assistant who was appointed by July 30th, you are exempt from the automatic enrollment and waiver process. If you're appointed after July 30th, then you can submit a waiver by submitting your GA offer letter. So that's a caveat basically for graduate assistants, because graduate assistants have the option to enroll in the state of Maryland plan. So we were trying to make it easy for graduate assistants. It didn't turn out as easy as we had hoped. But in any case, if you are a graduate assistant, if you follow that second bullet, sort of outlines what you need to know. First, you have to find out what your hire date was, and your department can tell you that. And if it was after July 30th, then you are required to submit a waiver. And to do that, you just need to submit your GA offer letter. So it's pretty simple. It's a very fast process. So, and just go into the third bullet, if you're not a graduate assistant and you're full-time, then that means you will be automatically enrolled. But if you already have insurance, you submit a waiver to either avoid the charge or to initiate a refund of the charge. You have until September 30th to submit the waiver. So if your account has been charged and you already have insurance somewhere else, submit the waiver and that charge will be removed from your student account. Any questions? Okay, I've mentioned academic health plans a lot. And this is just a sort of a list of what they do for you. As I said, they are the administrator for the student health insurance plan. And they provide these services. They help you with enrollment. They help you with waiving out of insurance. They provide United Healthcare plan materials and details and a connection to United Healthcare. So once you are enrolled, your claims and all your anything that is related to your health insurance needs is done by United Healthcare. AHP just sort of manages that. AHP is your connection to United Healthcare. So they provide customer service. They can help answer your questions. They have a chat button. They have a help button. And one thing that they also have that can help you understand insurance in general is they have if you go to their website, in the corner of their website, there's a Get Help tab, and they have a video library and a glossary of terms right there. And that can assist you in just learning about insurance. So a list of resources here on this slide, the AHP website, as I just was talking about, the UMD Health Center. I have not talked about the Health Center, but that is a great resource here on campus. And if you have the student health insurance plan and you go to the Health Center for a sick visit or a well visit or something, they do not charge you a copay. And that's the first time I've used that term. I'm not sure if you know what a copay is. So I'll just briefly go over it. So if you have the student health insurance plan and you need help, you need to go see a doctor at the health center, you go. And normally when somebody goes to see a doctor and they have insurance, there's a copay. So the insurance pays a large part of the visit, and then the insurance holder, you, would pay a small portion. That's called the copay. So when you have the student health insurance plan, there is no copay when you go to the UMD Health Center. So that's a nice benefit from SHIP. Graduate school health insurance information page is always available for just trying to understand it a little bit more. And if you're looking for insurance outside of the student health insurance plan, or outside of the state of Maryland, if you're not a graduate assistant, you're going to need insurance. One option to go to is healthcare.gov. And through that site, you can figure out if you might qualify for a subsidy in getting health insurance. Basically, when you go to that site, it asks you to input your zip code, where you live, to see what available plans are in your area, in your state. And then you can see if you would qualify for a subsidy that way. That's all a governmental thing. I'm not involved in that at all, but I want to make sure that students understand that that's a resource for them.
Hey, Robin, we have a question. I'm an incoming grad student with a GTA offer. Do incoming GAs fall within the July 30th timeline or not?
Most graduate assistants who are new do fall into that timeline, but not all. It just sort of depends. If many international students don't even arrive in the US until after July 30th. So there are many times where international students do not quite get appointed by July 30th. So in those cases, if you're appointed after July 30th, then you can submit the waiver on the Academic Health Plan's website by submitting your GA offer letter. And that will waive you out of the insurance, the SHIP requirement, or the SHIP automatic enrollment.
Okay, thank you. Another question, this was submitted by a student who registered. And they say, how do you use insurance for the vaccines required by the university?
Well, I don't work at the health center, so I don't know exactly how the health center works. But if you go to, I basically have to refer you to the health center. I'm sure that a lot of that is all covered in various ways through your insurance plan. So, on this slide that is currently up, the UMD Health Center is there, and there's a place for UMD Health Center appointments. You can make an appointment at the health center and get the vaccines you need and ask them about how it gets paid for.
All right, sounds good. Thank you. Right, I don't see any more questions. So do you want to go ahead and review this slide?
Oh, this was just a slide that it's another resource slide to provide you with access to additional information. Academic health plans is the first one. That's how you enroll in SHIP. It's also how you might waive out of SHIP. United Healthcare, the insurance carrier for SHIP. This is their website and their phone number. So if you were to enroll in the student health insurance plan and you want your ID card, you would need to go to the United Healthcare website to get your ID card. So this can start you off in that process. The health center the website is there, and their phone number, and a place for you to get create an appointment, get yourself an appointment at the health center. If you are a graduate assistant and you are interested in the state of Maryland plan, this site, the UMD Human Resources site, provides an overview of the different plans and the cost structures. So visit that site to learn more about the UMD state of Maryland plans. And of course, our graduate school website also provides information. I think that might be my last slide. Let's see if I can turn it up. I don't know why my computer is not there. No, there it goes.
There we go.
That's
There
my
you are.
contact information. If you want to email me with your specific situation, I'm happy to read through it and give you and reply back with information about how you can move forward in either submitting a waiver, enrolling in SHIP, getting your state of Maryland plan. It all depends on your particular situation. So you just need to tell me some details and I can provide you with direction.
Got it. Thank you, Robin.
Sure. And if you have, I don't have Amanda's, I don't have the, I just realized I don't have the help email for AHP on my slides. I'll add that before I share it.
Okay. We do have another question. All right, here we go. Hi, I have a question. Since it is the 15th of August already, when will we get the insurance ID card, account number, or password? I sent an email to the SHIP carrier to ask that, but I have not received a response yet.
Amanda, is this the kind of question that you often get?
Yes, we did get that question quite a bit.
Okay, I'm gonna give the floor to you.
Okay, so what happens is if they do the waiver, and they don't get the insurance, that's not what we're talking about. If they do the one-click enroll, the files are.
I'm sorry. Let me just. I'm sorry.
Okay.
I can barely hear you. First of all, Amanda, it's sort of in and out. That's one. And then, just to clarify for this question, I'm assuming this person is talking about the student health insurance plan. I think they are.
Yeah, they did not specify, so you could,
Yes.
and they say yes.
Okay.
Okay.
Good. I just want to make sure
So-
we're talking about the same thing.
So just to review, when can students expect to get their insurance ID cards, account numbers, whatever they need?
Okay, can you hear me better now, Robin?
I can. Thank you.
Okay. Once the policies are file transferred over to the carrier, then the insurance cards will be available. So they have to go to the the website provided by Academic Health Plans, and they have to either request an electronic ID card or they can request the printed ID cards. Here at Academic Health Plans, we don't mail them out anymore. We provide the links, and they can go to Blue Cross Blue Shield or Aetna, whatever the coverage is, and they can create an account and request their cards from there. Now,
Right.
if they do need access to their cards before all of this process takes place, they can reach out to us and we can provide them with the information if they need to go to the doctor that they will need. It's kind of
Got
like a paper copy of the data, but it's not an actual insurance card.
Okay, so the student says that they need their account number to put that in to request the card. So how do they get their account number?
That should be available on the AHP website on their account when they go in there and look at that. The same place they go to enroll.
Okay,
They should.
the AHP website is, let's review that again.
The AHP website is
UMD My AHP Care
yes.
.com. I think this is it. I just sent it in the chat. Let's see if I copy. Let's make sure I did that right.
Okay. And I will attach this. I'm going to go ahead and put in the chat the help email for the students who have questions that they want to get a hold of us, so they
great,
can
thanks.
have.
Thank you, Amanda.
Uh-huh.
Great, thank you.
There's that.
Okay. So if that student is having trouble, they should contact you at that email address.
Yes. If they need their cards quicker than they're getting them, like if they've got an
Yeah.
emergency or something, we can get that for them.
Okay. Okay, great. Amanda, I know Robin covered a lot. Is there anything that you want to cover or elaborate on?
I like to share with students because a lot of people are unaware and don't really understand it, but there's an in-network and an out-of-network. So you want to go onto the links that we've provided, and you want to read and learn about your benefits that you have. Our insurance is also nationwide, and it covers the students anywhere they're at. So it's all, if they're traveling, maybe they can plan ahead of time, do a little bit of research, find networks, providers that they can see in case of an emergency, so that they know these things ahead of time.
Thank you. That's a good point. I did forget to
Yeah.
mention that it's a nationwide plan, right? So I mean,
Yeah.
this United Healthcare is available wherever you go in the United States.
All right. Any other questions? Anything else? Okay, I don't see any questions. Robin and Amanda, this was really helpful. I hope that students will reach out, and we will be sure to share all these resources after the workshop with everybody who registered. We'll post it on our website, and Robin, I know the grad school does a good job of sharing resources. So it was really good for us to spend some time together to discuss this. I want to invite everyone who is watching this either on YouTube or attending in person. Please do the workshop evaluation, because we want to be helpful to students and supportive, and let us know, are we doing a good job, or do you have some suggestions? So let's see. I just want to invite you to breakfast, everybody. We are having a GRadulting breakfast on Tuesday, September 5th in the Stamp. So we will be putting that all over social media and in our briefing, and we hope that we'll see you there. It's free and it will be delicious. I think breakfast burritos are on the menu. So we would love to connect with you then. And Robin and Amanda, you can come too. So, thanks everybody for your time, and have a great week. Remember, let us know how legal aid and how the graduate school can help you. Take care.
Thank you.